Hey, what's up everybody? Welcome back to my YouTube channel. I am Dr. Allie, I am an OBGYN, and here on my YouTube channel, I talk about all things women's health, from periods to pregnancy to birth control to what to expect at your first visit to the gynecologist. All right, you all, I know I have not made a YouTube video in a while. Life got a little bit ahead of me. I had family visiting in town, really busy at work. If you follow me on Instagram, you know that I am banned from wearing this color at the hospital. I had a pretty bad postpartum hemorrhage wearing this color, and if you know anything about labor and delivery, you know that we're very superstitious people, so no more red at the hospital, hence why I have to wear it at home while I film YouTube videos. So today's YouTube video is inspired by an Instagram post that I made a couple weeks ago explaining that, confession, I no-showed my first ever visit to the gynecologist. At that time in my life, I was embarrassed to go, I was ashamed, I was nervous, I was anxious. I didn't even call to cancel, I just no-showed. I was just like, nope, not doing it, not happening, I don't need it. So I wanted to come on here and let you guys know that while I am an OBGYN, I know what it's like to be very nervous, very anxious, to want to cancel your appointment, to feel like you don't need it because you feel healthy. I know how uncomfortable it can be to have those difficult conversations. And that's mainly because when I grew up, I didn't have anyone to talk to these things about. And it was very scary to talk to the stranger and feel exposed and vulnerable. So I get it. And today I'm here to hopefully help you guys feel more comfortable when you come see us as gynecologists. Trust me, I know that going to the doctor is not fun. I don't think anyone really looks forward to coming to see me. I know that I don't love going to the doctor. I know doctors are probably the worst patients, but I go because I know it's important for my health, and I want to encourage you all and to be able to empower you all with the information that you need so you go make yourself and your health a priority. All right, you guys, before we jump into the video, please hit that subscribe button. I would love it if you became part of this family. I hope that my videos inspire you, educate you, empower you. Become part of the family. I think you'll like it here. So enough of an intro for today. Let's jump right into the information. So in today's video, I'm going to start off by explaining at what age you should start going to the gynecologist, what to expect at your first visit, what subsequent visits look like, how frequent you should go see your OBGYN, and how the visits are going to change as we age. This video is going to have a part 2 where I actually answer your questions related to coming to see a gynecologist. So when should you go make your first visit to see a gynecologist? My recommendation, and what I think is going to be most beneficial, is to go see the gynecologist when you first start your period, or maybe just establish care when you're 13. So if you're a mom and you have a daughter and you're not really sure what age you need to start taking your daughter to the gynecologist, I always say that by age 13, it's a good idea to take them to the gynecologist. Now, I don't want you to freak out. I understand that 13 might seem a little young. The purpose of this visit is to establish care. I like to see these young patients in my office because it's an amazing opportunity to talk about all of the changes that their bodies are going through. I like to sit down, explain the menstrual cycle, why it is we get a period, what a normal period looks like, when we should be concerned about heavy bleeding or really bad cramps, asking them if they've experienced any symptoms that they don't really know what it means. Thinking about vaginal discharge, what's normal, what's abnormal. It's a great age to start talking about birth control and safe sex practices. It's also a great time for them to be exposed to seeing a gynecologist and starting to develop that relationship with your gynecologist. That way, as they get older and they see us more frequently, or it's time to do a pap smear, they're not nervous because it's someone familiar that they've known since they were 13, 14 years old. They feel comfortable with me and they kind of know what to expect already. They know what questions they can ask me. It's just a really good time to start to build that foundation and that relationship. I might get a little off topic here, but I think this is something that as a society and culturally, something that we've struggled with, at least here in the United States, and me being a Latina, I can also specifically speak to my culture. I think it's important because at that young age, all of these rapid changes are happening, hormones are going on, you're starting to get different feelings, etc., and you're full of so many questions. And these young girls, they most typically just go to their friends for help and for these questions. So why not give them the opportunity to go to someone who's a professional in their field to get right answers? There's so much misinformation, so many myths, so many crazy things on the internet or that you can hear from family members or friends. Why not make that appointment so that your daughter or you yourself are getting correct information from a professional? So yeah, those are my 2 cents on why I encourage that young girls establish care early with an OBGYN. So let me walk you through what a typical visit would look like if you're going to the gynecologist for the first time and you're a young teenager. First, you would come to the office. A nurse or a medical assistant would room you and your patient, check your vital signs, ask you the purpose of your visit, if you have any questions or concerns. After that, me as the provider would walk in, introduce myself, and I immediately like to establish care. I want to know how old you are, what grade you're in, what you like to do for fun before we jump into all the craziness. Then one of the most important questions that I ask, and all gynecologists will agree, is when was your last menstrual period? When did you first start having periods? And what does your bleeding pattern look like? After that, I like to just sit down and with use of diagrams, pictures, all the things, I explain the menstrual cycle. I talk about what a normal menstrual cycle is, how much bleeding we should typically expect, symptoms, what we can do for cramps, etc. I also like to ask if they're sexually active, if they're considering becoming sexually active, have they heard of birth control? Do they want me to explain the different kinds of birth control available? The ball is in my patient's court. They get to decide what they want to talk about and what questions they have for me. After we get done talking about that, all of the questions are answered, all of the symptoms have been addressed, it's time for a physical exam. And like I mentioned earlier on in the video, typically in this younger age population, there is absolutely no need to do a pelvic exam. Now, this may not apply to everyone. Some might need a pelvic exam, might have a concern, a bump, or something that they want me to look at. But as a general rule, someone in this age group does not need a pelvic exam. So most of my patients don't even get undressed when they come to see me and they're this young. So the part of the physical exam that can be done is listening to heart and lungs, and if the patient desires, doing a breast exam. Again, this is gonna vary patient to patient. Maybe someone has a concern about what's normal breast development versus abnormal. So that would be a good opportunity to start to show them what a breast exam would look like or how to do one at home. As we get older, these exams start to look a little bit different. So here in the United States, it is recommended to start doing your pap smears at the age of 21. Regardless of whether or not you are sexually active or have never been sexually active, it is still recommended to get a pap smear starting at the age of 21. Now, I plan to do an entire video where I really discuss pap smears, different results that we can get, how often we should get them, why do some women get them every year, why do some women get them every 5 years. I know the guidelines can be a little bit confusing, which is why I think it's important to make a whole video just about pap smears. So be on the lookout for that video because I promise you it's coming. So you're 21, you go to the gynecologist, you're due for your first pap smear. What does that visit look like? So essentially, the whole beginning part is going to look very similar to someone who comes to see a gynecologist and they're 13. You check in at the front office, a nurse or an MA, medical assistant, will take your vitals, weight, put you in the room, ask you the same things. Go over any symptoms, the purpose of your visit, questions that you may have, review your past medical history, all that good stuff. Afterward, I would come in, same thing, meet you. If we already have that relationship developed because I've seen you before, then we can kind of jump right into your concerns and your visit. If you're new to my office, I always like to introduce myself, obviously, get to know you a little bit better, really talk about, do you understand your menstrual cycle? What's the purpose of your visit? Etc., etc. So that portion is going to look different for every patient because not everyone's gonna have the same concerns. Essentially, once we're done talking about everything, it is now time for your physical exam. Same thing, I like to start my exams listening to heart and lungs. We do a quick breast exam, we can check thyroid, we can do an abdominal exam, and I always do the pelvic exam last. I always make sure before starting a pelvic exam that my patient feels comfortable, isn't nervous, and that they understand what I'm going to be doing, why we do it. A lot of the time, that includes this friend right here. This is a speculum. I always like to pull one out, show the speculum to the patient. I will hand it to the patient, have them hold it, have them figure out how it works, how exactly we insert it. What happens when we, push down on the little handle so that we can see the cervix better. I walk through the whole process of a pelvic exam. And then of course we have the lovely footrest, as one of my attendings used to call it. More commonly they're called stirrups, where you place both feet up on the stirrups. And yes, you will slide down the edge of the exam table till your bottom kind of feels like it's hanging off the edge. I always tell my patients, it's going to be an uncomfortable position. It might feel like you're gonna fall off. I will not let them fall off. But essentially, as I'm doing the pelvic exam, I always like to tell my patient, take a slow, deep breath, focus on wiggling your toes, which sounds crazy. It's what I do during all of my pelvic exams. But when you focus on wiggling your toes, it gives you just your mind away from what's happening, and it really truly does relax. I like to talk my patients throughout the entire process, letting them know when they're gonna feel touch, pressure, a little bit of discomfort. Always know that while you're getting a pelvic exam, it should never be painful. Is it uncomfortable? Yes, getting a pelvic exam is always gonna be slightly uncomfortable, but if you're ever experiencing any amount of pain, you have to let us know. I need to stop talking with this, so we're gonna set her down. Like I was saying, if you're ever uncomfortable, feeling too much pain, or feel like you just need a break, tell us, because we will stop. So while we're doing our pelvic exam, we will collect our pap smear, we will collect gonorrhea and chlamydia testing, or anything else that you want us to look for. Once the speculum comes out, the last part of the pelvic exam is what's called a bimanual exam. A bimanual exam is a method for us to feel for your uterus and your ovaries. See if we feel any cysts, any masses, anything abnormal. See if you're really tender when we do the exam. Is there a possibility that there's an infection, or is there a mass that's causing some sort of issue? So during this exam, one finger is placed inside of the vagina. Gosh. So during this exam, one finger is placed inside of the vagina and the other hand I place in your lower belly. With this motion of one finger in the vagina and the hand on your lower abdomen, I can really feel for your uterus and I can feel for both ovaries. This part of the exam is usually fairly quick and again, a little bit uncomfortable, but shouldn't be painful. So after that, your physical exam is all done. You can sit up, start getting dressed. I like to wrap up, kind of address everything that we talked about. Hey, I'll get pap smear results in a couple days and we'll call you and let you know when you're due for your next one. I'm going to send whatever medication we talked about to your pharmacy. Make sure you pick that up, explain how to take the medication properly, what signs, symptoms, or anything, that they may be feeling when starting a new medication, or when it would be important for them to call or make a follow-up appointment with me. We review when their next visit should be, talk about, hey, we really need to follow up, or we need to get imaging or ultrasound or anything like that. I kind of wrap up at the end of the visit. After that, you're done and you get to go home. All right, so that brings us to the end of the video. I hope you guys liked this one. I hoped it made you feel a little less nervous about going to see your gynecologist. I know how scary it can be, but I promise you, making your health a priority is extremely important. I know that you feel healthy, that you feel like nothing is wrong and that you're maybe invincible, but please, as a gynecologist, I have seen some very difficult, sad, horrible situations because patients didn't want to go get a pap smear and end up with cervical cancer, even at a very young age. Cervical cancer is something we can detect early with a pap smear, and I cannot stress enough how important it is to go to the doctor. So after watching this video, I hope you feel empowered and educated and know what to expect for your next visit or your first visit. All right, thank you so much for watching this video. I love you guys so much. I love all of your support on here, on Instagram, on TikTok, on my blog. You guys are my virtual family, and I just send you so much love and so much joy. So don't forget to subscribe to my YouTube channel, give this video a thumbs up, ring the little bell notification so you know when I have a new YouTube video coming out. I will leave all of my social media linked down below. Instagram, TikTok, my blog, all the things are linked down below. Don't forget to be kind and show love to everyone around you. Have an amazing week. I love you all, and I'll see you in my next video, which will be part 2 of this video where I answer your questions. Bye.